Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Miss Daniels. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Miss Daniels. How can I assist you today?
Hi, doctor. I'm not sure where to start, but I've been having these strange aches and pains all over my body. It's been going on for a while now, and I'm starting to get really frustrated.
I'm sorry to hear that. Can you describe the pain a little more? When did it start, and where do you feel it the most?
It started maybe about 6 months ago, but it's gotten worse recently. It's a deep aching pain. One day it's in my arms, the next day it's in my legs, then my back. It's unpredictable and seems to move around. Some days I wake up, and I just feel stiff and sore all over.
That sounds quite uncomfortable. Is the pain constant, or does it come and go throughout the day?
It comes and goes, but there's always some level of discomfort. And it's not just the pain, I feel exhausted all the time. Even after a full night's sleep, I wake up feeling drained, and simple tasks leave me feeling worn out.
I see. Fatigue is a common issue with certain conditions. Have you noticed any other symptoms, trouble concentrating, headaches, or maybe sensitivity to cold or touch?
Yes. Actually, I've been having terrible headaches, and I sometimes feel like my brain is in a fog. It's hard to focus, even on simple things. I also seem to get these sharp pains when something barely touches my skin, like my clothes or even a light tap.
Thank you for sharing all of that, Miss Daniels. From what you're describing, it sounds like you might be experiencing symptoms of fibromyalgia. It's a condition that causes widespread pain and tenderness in the muscles, along with fatigue and cognitive difficulties, sometimes referred to as fibro-fog.
Fibromyalgia? I've heard of it but never thought that could be what's happening. What causes it?
The exact cause isn't fully understood, but we believe it's related to how the brain and spinal cord process pain signals. For people with fibromyalgia, the brain can amplify pain signals, making even light touches or normal movements feel painful. Stress, physical trauma, or infections can sometimes trigger the onset of fibromyalgia, though it often develops without a clear cause.
That actually makes sense. I had a pretty bad fall last year, and I've been under a lot of stress at work lately. But does that mean there's no cure?
Unfortunately, there's no cure for fibromyalgia at the moment, but the good news is that there are many ways we can manage the symptoms and improve your quality of life. It usually involves a combination of treatments like medication, lifestyle changes, and physical therapy.
I'm willing to try anything at this point. The pain is really affecting my life. I've had to cut back on work, and I can't enjoy the things I used to. What kinds of treatments are we talking about?
For starters, medications can help. Some people benefit from pain relievers or certain antidepressants that target nerve pain and improve sleep. We can also explore muscle relaxants or medications specifically designed for nerve pain, like pregabalin or gabapentin.
Will the medications stop the pain completely?
They may not eliminate the pain entirely, but they can make it much more manageable. We can also work on other strategies. Regular gentle exercise, like walking or swimming, has been shown to help many people with fibromyalgia, even though it might feel difficult at first. Exercise can improve muscle strength, boost your energy levels, and reduce pain over time.
Exercise sounds good, but I'm worried about making the pain worse.
That's a common concern. We would start very slowly, with light activities and build up gradually. It's important not to overdo it, but gentle, consistent movement is key. I'd recommend seeing a physiotherapist who can create a tailored plan for you.
Okay, I can give that a try. What else can I do to help manage this?
Sleep is also crucial. It sounds like your sleep isn't very restful at the moment, so we might need to address that. Developing good sleep habits, such as keeping a regular sleep schedule, creating a relaxing bedtime routine, and managing stress, can make a big difference. Sometimes, medication to improve sleep quality is necessary.
I definitely need help with my sleep. Some nights it feels like I'm just tossing and turning, and even when I do sleep, I wake up feeling like I've run a marathon.
We can look into some options to help improve your sleep. Another aspect to consider is stress management. Since stress can worsen fibromyalgia symptoms, relaxation techniques like deep breathing, meditation, or mindfulness can be really beneficial.
I've tried meditation a few times, but I find it hard to stick with it. Maybe I need to give it another shot.
It can be hard to stay consistent with, but even small efforts can make a big difference over time. I can refer you to a counselor or therapist if you think that might help, particularly if stress has been a big factor for you lately.
That might be helpful. I'm just glad to have a name for what's been going on. It's been frustrating not knowing what was wrong.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Evan Whitman. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Whitman. I've reviewed some of your history, but I'd like to hear directly from you. Can you start by telling me how long you've been dealing with your current symptoms and what led you here today?
Sure, it's been about 6 months now. At first, I just had this dull pain in my stomach, especially after meals. I thought it might just be stress or something I ate, but the pain didn't go away. It started getting worse and more frequent, and I began to feel it even when I hadn't eaten anything.
That sounds uncomfortable. Was there anything specific you noticed that made the pain worse or better? For example, did certain foods trigger it, or did anything like antacids help?
Yeah, actually, antacids did help a bit at first. The pain would ease up for a while, but then it would come back, sometimes even stronger. I also started noticing that spicy foods or coffee made things worse, so I cut them out. But the pain kept coming back, and lately, it's been waking me up at night.
Nighttime pain is definitely something we take seriously, especially in cases like this. You mentioned cutting out spicy food and coffee. Have you had any other dietary changes or issues, like nausea or weight loss?
I've lost a bit of weight, but I think that's just because I haven't been eating as much. The pain makes it hard to enjoy meals, so I'm eating smaller portions, and sometimes I skip meals altogether. I haven't really had nausea, though, which is good, I guess.
Yes, that's important information. Based on what you've described, it sounds like you may be dealing with a peptic ulcer. Ulcers are sores that develop in the lining of your stomach or the first part of your small intestine. They can cause that burning pain you're feeling, especially after eating or during the night. Have you ever been tested for H. pylori, the bacteria often linked to ulcers.
I haven't been tested for anything like that, no. I wasn't even sure what was going on until my GP suggested it could be an ulcer and referred me to you.
That was a good call by your GP. H. pylori is a common cause of peptic ulcers, but other factors like long-term use of NSAIDs, painkillers like ibuprofen, can also contribute. Do you take any medications regularly, especially over-the-counter pain relievers?
Yeah, I've been taking ibuprofen on and off for years. I've had some back pain issues, so I take it pretty regularly, sometimes on an empty stomach.
That might be a key factor here. NSAIDs like ibuprofen can irritate the stomach lining and make it more vulnerable to developing ulcers, especially when taken frequently or without food. Between that and the symptoms you've described, there's a strong possibility you have a peptic ulcer. We'll need to confirm that with a couple of tests, likely starting with an endoscopy. That way, we can take a close look at your stomach and see if there are any visible ulcers.
Endoscopy? Is that where you use a camera to look inside my stomach?
Exactly. It's a relatively quick procedure, done under mild sedation. We use a thin tube with a camera at the end to examine your esophagus, stomach, and small intestine. It allows us to check for ulcers or any other abnormalities. If we see anything suspicious, we can take a biopsy for further testing.
That sounds a bit intimidating, but I guess it's necessary.
I understand it can seem daunting, but it's a routine procedure, and it will give us the clearest picture of what's going on. If we confirm an ulcer, we'll then focus on treating it. The good news is that peptic ulcers often heal with the right approach. Treatment typically involves medication to reduce stomach acid, such as proton pump inhibitors (PPIs), and if H. pylori is present, we'll add antibiotics to get rid of the infection.
And how long would treatment take? Will I feel better quickly?
Most people start feeling relief within a few days to a week of starting medication, but the full healing process can take about 4 to 8 weeks. During that time, it's important to avoid things that can aggravate the ulcer, like NSAIDs, smoking, alcohol, and certain foods like the spicy ones you mentioned. We'll also discuss some lifestyle adjustments to help prevent future issues.
That's a relief to hear. I'm definitely ready to make whatever changes are needed. I just want to get back to feeling normal again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a consultant's discussion with a trainee. Now read the question.
Have we got Mrs. White's records?
Yes, they're here. She's coming in today to discuss alternative treatments for her chronic pain, isn't she?
Well, depending on her preferences, and from the research I've reviewed, there's promising data on the use of cone snail venom for pain relief, so we might suggest trying it before moving to more invasive procedures. Unless her pain has worsened significantly.
So what's the science behind it?
We know that the venom blocks pain signals from reaching the brain, which is why it's so effective. But we're still learning how to harness it in a controlled manner. There's ongoing research, but early results are quite positive.
Now look at question 26. You hear a paramedic briefing a doctor on a recent burn injury involving an elderly patient. Now read the question.
Significant discomfort despite the burn being relatively small. Given her age, we suspect her skin may be more fragile, and she could be at a higher risk of complications. We applied a cool compress to the burn site and administered a low-dose pain reliever. I've also reached out to her daughter, who is on her way. You may want to assess whether further treatment or observation is needed due to her age.
Now look at question 27. You hear a senior healthcare administrator discussing drug abuse with a junior doctor. Now read the question.
Dr. Collins, you've been working in healthcare for about 5 years now, haven't you?
Yes, that's right. In that time, I've seen a worrying rise in substance abuse issues, especially among medical professionals. It seems to be connected to the increased stress and emotional demands of the job.
You're not wrong. I've noticed a pattern as well. Many young doctors, unable to handle the constant pressure, often turn to substances to cope. It's become more common for medical staff to struggle with work-life balance, which can lead to these issues escalating.
I agree. The long shifts and emotional toll leave very little room for personal well-being. The problem is exacerbated by the lack of mental health support for healthcare workers.
Absolutely, and I've heard quite a few staff members say that, with the workdays getting longer, it's increasingly hard to manage stress without resorting to unhealthy coping mechanisms. For those with families, this becomes even more challenging.
Yes, 14-hour shifts aren't unusual anymore. Many people feel the only way to get through it is by relying on drugs or alcohol. In my opinion, the healthcare system's approach to mental health needs urgent reform.
Now look at question 28. You hear a conversation between a nutritionist and a dietitian about the impact of convenience foods. Now read the question.
So, Dr. Emily, I've already spent over an hour reviewing the data on the health effects of the various convenience foods our patients have been consuming. I'm trying to figure out which types of foods we should emphasize in our dietary advice, and which ones are best avoided entirely.
Okay, let me see if I can assist with that. We are already seeing more patients presenting with conditions like obesity and diabetes, and it seems clear that unhealthy eating habits are a major factor.
Yes, it's becoming a real challenge to manage nutrition advice when patients are constantly surrounded by processed food choices.
That's definitely true. I also have a backlog of dietary consultations and paperwork waiting. I wish we had clearer strategies in place until the new dietary guidelines are published, but
Now look at question 29. You hear a medical professional explaining some theories. Now read the question.
Today, we're exploring a few key nursing theories that have greatly influenced our practice. First, Florence Nightingale's environmental theory emphasizes the significance of creating a healthy environment, focusing on cleanliness and ventilation, to support recovery. Next, Jean Watson's theory of human caring centers on the human connection in nursing. Watson believes caring relationships, rooted in empathy and compassion, are crucial for promoting healing and well-being. Finally, Dorothea Orum's self-care deficit theory focuses on helping patients become more self-reliant in managing their health, with nurses providing guidance where needed. These theories collectively shape how nurses deliver holistic care.
Now look at question 30. You hear a nurse explaining about a patient to a doctor. Now read the question.
have a moment. I'd like to discuss a case with you.
Sure, what's going on?
We have a 56-year-old male patient who recently underwent a vertebroplasty for a spinal fracture. He's now experiencing sharp chest pain and shortness of breath. Imaging shows a 4-inch piece of cement that appears to have migrated from the vertebroplasty site into his bloodstream. It seems to have lodged in his heart, specifically in the upper right chamber, and there's evidence of a lung puncture as well.
That sounds quite serious. The immediate priority would be to stabilize him and consult cardiothoracic surgery to remove the cement. We should also check for any ongoing bleeding or cardiac tamponade. A CT angiogram will give us a clearer picture of the damage and the risk of further complications. If the piece is not removed, it could lead to a rupture or further cardiac damage.
Understood. I'll start coordinating with surgery right away.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with dietitian, Dr. Laura Peterson. You now have 90 seconds to read questions.
Welcome to Health Talk, everyone. Today, we're exploring a topic that sparks endless debate among nutritionists and the general public alike: vegetarian versus non-vegetarian diets. With us is Dr. Laura Peterson, a dietitian and nutrition expert from St. Mary's Hospital. Dr. Peterson, thank you for joining us.
It's my pleasure. I'm excited to discuss the health implications of these dietary choices and share insights into what research says.
Great. So, Dr. Peterson, let's dive right in. Non-vegetarian diets often get criticized for their potential health risks, yet many people argue they offer essential nutrients. Could you briefly explain the core health benefits associated with a non-vegetarian diet?
Absolutely. A non-vegetarian diet typically includes meat, fish, and poultry, which are excellent sources of high-quality protein. These foods are rich in essential amino acids, vitamins such as B12, and minerals like iron and zinc. For example, iron from red meat is more readily absorbed by the body compared to plant-based sources. Additionally, fatty fish like salmon provide omega-3 fatty acids, which are essential for heart health and brain function.
That sounds important, especially for maintaining overall health. But critics often argue about the drawbacks of consuming meat, particularly red and processed meat. What are the health risks associated with a non-vegetarian diet?
That's a crucial point. While non-vegetarian diets offer several benefits, they can also come with risks if not balanced properly. High consumption of red and processed meats, for example, has been linked to increased risks of cardiovascular diseases, hypertension, and certain cancers, particularly colorectal cancer. Processed meats are often high in sodium and preservatives, which can lead to issues like high blood pressure. It's also worth noting that excessive meat intake, particularly fatty cuts, can raise cholesterol levels and increase the likelihood of developing heart disease.
So, moderation seems to be key. What about vegetarian diets? They're often touted as a healthier alternative. How do they compare in terms of health benefits?
Vegetarian diets do have a number of health benefits, particularly in reducing the risk of chronic diseases. Plant-based diets are typically lower in saturated fat and cholesterol and higher in fiber, antioxidants, and essential nutrients such as vitamins C and E. Numerous studies have shown that vegetarians tend to have lower rates of heart disease, high blood pressure, type 2 diabetes, and even some cancers. The absence of processed meats and the focus on whole plant-based foods certainly contribute to these health outcomes.
Those are significant advantages. But like any diet, I'm sure there are drawbacks. What are the main challenges people face with vegetarian diets?
Yes, vegetarian diets, while healthy, can pose some nutritional challenges. The most common issue is getting enough complete protein. Plant-based proteins often lack one or more essential amino acids, so vegetarians need to combine different sources, like beans and rice, to ensure they're meeting their protein needs. Another challenge is obtaining enough vitamin B12, iron, and omega-3 fatty acids, which are more abundant in animal products. Without careful planning, a vegetarian diet can lead to deficiencies in these areas, potentially causing anemia or decreased energy levels.
That's really insightful. With both diets having pros and cons, how can someone decide which is best for them?
It really depends on individual health needs, lifestyle, and ethical beliefs. Some people thrive on a non-vegetarian diet and rely on it for the nutrients their bodies need. Others feel healthier and more energized on a vegetarian or plant-based diet. I recommend focusing on a balanced diet, regardless of which you choose. Both non-vegetarians and vegetarians should aim for a variety of whole, minimally processed foods and monitor their intake of essential nutrients. Consulting a dietitian can also help tailor a plan to meet specific health goals.
That makes sense. Before we wrap up, could you share an example of how someone has successfully transitioned between these diets for health reasons?
Sure. I recently worked with a patient, Mark, who had been following a non-vegetarian diet for most of his life. In his mid-40s, he began experiencing high cholesterol and borderline hypertension. After discussing his options, he decided to transition to a primarily vegetarian diet. Over the course of 6 months, we increased his intake of legumes, vegetables, and whole grains while reducing red meat and processed foods. The results were remarkable. His cholesterol levels dropped and his blood pressure returned to normal ranges. However, we made sure to include occasional fish and eggs to ensure he was getting enough protein and omega-3.
That's inspiring. It's amazing how dietary changes can have such a profound impact on health. Are there any final tips you'd offer to listeners who might be considering a change in their diet?
Absolutely. I encourage everyone to make gradual changes rather than sudden shifts, whether you're adding more plant-based foods or incorporating lean meats into your diet. It's important to listen to your body and pay attention to how you feel. Variety is key to ensuring you get a wide range of nutrients. And again, consulting a healthcare professional or dietitian can be invaluable in making sure your diet supports your long-term health.
Great advice. Thank you, Dr. Peterson, for sharing such valuable insights today.
Thank you for having me. It's been a pleasure.
And thank you to our listeners for tuning in to Health Talk. Remember, whether you choose a vegetarian or non-vegetarian diet, balance and mindful eating are crucial to maintaining a healthy lifestyle. Until next time, stay healthy.
Extract 2. Questions 37 to 42. You hear radiologist giving a detailed presentation on liver lesions. Now, read the questions. You now have 90 seconds to read questions.
Hello everyone, thank you for attending today's presentation. I'm going to talk about a topic that is becoming increasingly common in radiology, incidental liver lesions detected during abdominal imaging. These incidental findings can create significant anxiety for both patients and healthcare providers, as determining whether a lesion is benign or malignant is not always straightforward. Let's first discuss what incidental liver lesions are. Simply put, these are abnormal areas in the liver that are detected on imaging when the patient is being scanned for reasons unrelated to liver disease. Many of these lesions are benign, meaning they are not cancerous and may not require treatment. However, there is always the concern that some lesions could be malignant or pre-malignant. It's important to note that not all liver lesions are the same, and distinguishing between benign and malignant lesions requires specific imaging techniques and expert interpretation. The incidence of liver lesions detected incidentally is growing due to the increased use of advanced imaging technologies, such as CT scans and MRIs, for other medical conditions. The widespread use of these imaging modalities means more asymptomatic people are being diagnosed with incidental liver lesions. However, the majority of these lesions are benign, especially in individuals with no history of liver disease. Common benign lesions include hemangiomas, focal nodular hyperplasia, and simple cysts. These types of lesions typically don't require intervention and are considered harmless. A key concern with incidental liver lesions is whether they represent early-stage liver cancer, particularly in high-risk populations. Populations with underlying liver conditions, such as hepatitis B, hepatitis C, or cirrhosis, are at a greater risk of developing liver cancer. This is where the guidelines for evaluating incidental liver lesions come into play. For patients with no risk factors for liver disease, most incidental lesions can be safely monitored or even ignored. However, in high-risk patients, more thorough investigation is warranted. New guidelines have been developed to help radiologists and clinicians better manage these incidental findings. The guidelines recommend multiphasic, contrast-enhanced cross-sectional imaging, such as CT or MRI, to better characterize liver lesions. These types of imaging allow us to examine the lesion in different phases of contrast uptake, which can help differentiate between benign and malignant lesions. Additionally, for some lesions, a biopsy may be necessary, though this is generally reserved for cases where the imaging results are inconclusive. One of the challenges we face is the anxiety these incidental findings cause for patients. Most people assume that if something abnormal shows up on an imaging study, it must be dangerous. However, as I've mentioned, the vast majority of incidental liver lesions are benign. It's important for healthcare providers to clearly communicate this to patients and offer reassurance when appropriate. Now let's move on to the topic of management. When a lesion is determined to be benign, no further treatment is usually required. In some cases, we may recommend follow-up imaging to ensure the lesion remains stable over time, especially if there are any uncertainties in the initial assessment. On the other hand, if the lesion is suspected to be malignant, further diagnostic steps, including biopsy or surgical consultation, may be necessary. Early detection and accurate diagnosis are crucial, especially in high-risk patients, as this can significantly impact prognosis and treatment outcomes. The introduction of these guidelines has greatly improved the management of incidental liver lesions, providing a clear pathway for determining which lesions require immediate action and which can be safely monitored. It's important to understand that incidental findings are not unique to the liver and can occur in other organs as well. However, the liver is a common site for these findings due to its size and the frequent use of abdominal imaging. To conclude, while incidental liver lesions are a common finding, particularly with the increasing use of imaging technologies, the vast majority are benign and do not require treatment. The key is identifying which lesions pose a risk, particularly in patients with underlying liver conditions. The use of advanced imaging techniques and adherence to the latest guidelines allows us to make this distinction more accurately. Healthcare providers should focus on minimizing patient anxiety by providing clear explanations and ensuring appropriate follow-up when necessary. Thank you for your attention, and I hope this presentation has shed some light on the complexity of incidental liver lesions and their management.
That is the end of Part C. You now have 2 minutes to check your answers.